going on? Why are so many American children sick? I think we have to face reality. We need to be clear. Autism is a public health crisis of historic proportions, worse than poliomyelitis. It's devastating a generation of children and their families. We need to face that reality. Autism is a national emergency. Can we skip to slide 5? There's a summary here of historical autism surveys in America. For a long time, we had low rates in America, about 1 in 10,000. Keep flipping. There we go. Then around 1990, something new and terrible happened to a generation of children. Autism rates didn't just rise, they multiplied. This escalation covered both full syndrome autism and the broader autism spectrum, including Asperger's. Some people claim this isn't real, that we're just doing better diagnosing. That's just wrong. If you read the old literature, the old surveys, they looked for everybody, and they couldn't find people. They didn't miss 99% of the children with autism. It's not hard to find a child with autism. It's obvious when they're autistic. The notion that we're just doing better diagnosing, even in the CDC studies, they're using the same methodology. So when you see those numbers rising, that's not because the methods are changing, it's because there are more cases. In the midst of this crisis, the federal agencies responsible for the health of our children have failed in their duty. CDC's negligence has led the way. Many of us believe CDC has actively covered up evidence surrounding autism's environmental causes. NIH, meanwhile, has received the lion's share of funding, money they've wasted on status quo research and gene studies. It's absurd to focus on genetic research in this crisis. There's no such thing as a genetic epidemic. I'll skip past a couple of examples of malfeasance. I'll just say that in the financial world, the result of pressure to manipulate numbers to provide the answers that bosses want has a name. It's called securities fraud. In medicine, there are similar pressures. They're called special interest politics and even peer review. And what CDC has given us is the medical equivalent of securities fraud, all to avoid the inconvenient reality of the autism epidemic. In the face of a national emergency, government agencies, especially CDC and NIH, have performed poorly and behaved badly. We need accountable new leadership on autism at NIH and CDC. We need an advisory committee that believes in combating autism, not newly stocked with appointees who actually oppose that mission. We need a Combating Autism Act that truly combats autism. We need to stop investing in the autism gene hunt and identify what has changed in the environment that it could possibly have injured so many children. The scope and the magnitude of these changes, it's complicated, yes, but it can't be that complicated. There have to be a very small list of things that could have changed. Ultimately, we need to face and answer the question, why are so many children sick? We'll only do that hard work if agency leaders are held accountable to the American people, not powerful interests in the medical industry. So we're asking you, the members of the committee, for your help. Please, let's not make this hearing a one-time episode. Please stay on the job in the next Congress. Root out the failures, the waste, the fraud, the negligence, and the abuse in these agencies that aren't doing their job. We need CDC and NIH to do their jobs, and they're not. There's a crisis. We need your help. Thanks very much for your time.